Amr, I know him from 2024 June when one of my friend was practicing for her exam. So I was being her patient. So I was listening to Amr just to be a good patient for her and give her tough time. I was ST2 at that time. So it really helped me and made my basis from that time. I became ST3 in September and I'm CCDing in September. I've used his 12 weeks extended course. I've used his crash course. All of these courses are really good in its own way. Extended course gives you experience of mock other people are doing. So if you want to listen to Masr and her detailed feedback, the way IPS should be, other people giving feedback, it's really good if you want to get some feedback on that. But crash course, I really found it most useful because when I was doing my house chores during commute, I was listening to Amr, and trust me, guys, in my exam, I had two stations. I would have missed those things if I was just reading the flashcards because he verbalized those things that these cases could come like that, and that's the way they came in the exam. So listening to those audios, which he's saying in the crash course, is equally important than reading the flashcards because there are a few extra bits that does mention, which are really good. And I really found his voice echoing in my head when I was speaking to the patient. So I would really appreciate for that. And especially there are a few things which you keep reading and they will come natural to you. So I would not stress enough for the practice that you do. I've done mock with them. I did quite early when I was preparing. So I did it in December just to keep an idea where do I lie and what thing I need to improve on. So I did got a really good feedback in December. So I was really overconfident, I would say. But good thing in my DND, I'm from Oxford, we do have frequent mocks happening every month. So I had every month a mock, and which really helped me. So if you cannot have a mock in the DND, practice yourself, practice among your group colleagues. And if you don't have anybody, practice in front of the mirror because that really empowers you. So on the days when I was not having a practice partner, I would do it in front of the mirror, record myself. I have been told one by an English actor that my expressions don't match my words. So being IMGs, these things we need to really be careful about that. You're not only saying it, you should be showing it as well. So make yourself show the empathy, especially if you're worrying about the patient, especially if you're showing goodwill. You shouldn't be following it with another question. You should be giving your pause. So it's really important and that should show. And the other thing is, which I learned from one of the actors, is say what you see and say what you hear. So it's really important. If the patient is quiet, you have to say, I can see you are quiet. Can you tell me a bit more? And what he's giving you information that doesn't make sense, or he's repeating the information, ask the same statement again. You're echoing him the statement, he has to open up with something. And it really worked wonders for me in the exam. If I had nothing else to say, I would echo their statement and they would give me a lot of useful information. So these were really good tactics I used. And one of the other thing I would strongly suggest is practice for a few things like the tricky stations. I practiced for them, so I was very comfortable during the exam. Practice for difficult patient in any form. For example, if you have a non-engaging patient, I have that in my exam. So I was not distressed because I had practiced in my real life. I had practiced with my partners as well, with my supervisors as well. Practice for patients with a complaint, for patients who are very talkative, mental health scenarios, ethical scenarios. So these common stations, rather than practicing every topic, practice on the common stations and make a framework for you, because these would really work for you in the exam. And what worked well for me was I was comfortable that I have practiced it and it worked well for me. Even I was out of my time, the patient was non-engaging for 5 minutes. I was still able to finish it. I did not worry about the diagnosis. I was going with the patient. The patient gave me a lot of information. So don't worry if you think you've lost the station. It's the IPS. And if you're good with the IPS, the patient gives you a lot. And I got a clear pass in the station. I thought I would have failed it. So it's just mainly how you deal with the patient. They give you all the information that you need. Just take it easy. Be easy on yourself and be good to the patient. And whatever clues they're giving you, you have to keep picking. So one of the clue which I would tell everyone is, if they are not listening to you, there's a clue there. And it happened on 3 of my stations. So pick it. Don't just ignore it. They'll throw it twice, and if you miss it twice, they would give you something else. They would not keep giving you the same. So clues are really important. I would just say that be yourself, be very easy. It's not a tough exam. We make it very difficult for ourselves. I was very sure I have failed the 3 stations, but I've got clear passes in them. It's just because we be harsh on ourselves. I was just maintaining a good rapport with the patient, and they were really good and nice to me.
Beenish,